Hi, I'm Dr. Taryn Pavane. I am an associate veterinarian here at Advanced Animal Care. I work both at the general practice and the emergency clinic. I graduated from Auburn University College of Veterinary Medicine in 2024.
So why did you choose to come and work for Advanced Animal Care?
So during my fourth year, I did an externship here during one of my clinical rotations, and I just fell in love with it there. It was such a tight-knit community, basically. The doctors here were all wonderful, offering to help at any time. I learned so much while I was here for only 2 weeks, and I just loved the culture that was here, so I decided to come here.
So what makes AAC different from other clinics?
I'd say I have never worked at a clinic that has as many wonderful workers as here. Everybody is so close, so willing to help everybody. We're all friends and family. It's people who I hang out with on the outside now because of working here. And so it's just been a really great, again, culture is a great word to use because everyone here is so close-knit, and it's such a great experience to come into work every day and feel like I'm working with my friends every day.
So how else would you describe the culture here?
That's a good question. I feel, again, as though everyone is so willing to help. I never feel like I'm left behind, even by other doctors, technicians, the triage. Everybody is always willing to collaborate, especially if I have something that's a very difficult case or a very difficult just time. In vet med, it's hard sometimes, so I always feel as though I'm supported, no matter what I need, whether it's professional or, again, in a friendship role.
What's your favorite part of the job?
Probably coming here and feeling like I'm hanging out with my friends. Obviously, I love being a veterinarian and I love helping animals, but again, it helps to be here with people who are supporting you and feel like you're friends and make your job more fun, especially, again, since it's such a difficult job. And so it's nice to have these friendly faces around that help you feel really supported.
So tell us about a typical day for you.
So depending if I'm at the general practice or the ER, it differs a little bit. For the emergency medicine side, I'm a daytime doctor, so I get here in the morning, I do rounds with the overnight technicians and doctors, and then I will do all of the inpatient work, see all my inpatients and come up with their plans, and then start to see appointments that come in as well. We range from doing urgent care visits to emergency visits, so there's a wide range of things, which is nice to have kind of a lot of experience and a lot of different cases. It definitely does not get boring. And then when it's my end of the shift, I run with those doctors and go from there. At the general practice, it's more just appointment based, but same thing. We see not only vaccines and things like that, there's a lot of sick appointments. And it's so nice to have the general practice next door to be able to send sick patients over here and continue their treatment. And so that's kind of what a day looks like over there.
So what case or type of patient gets you most excited?
Definitely internal medicine. I am much more on the internal medicine side than a surgery side. The other doctors are my surgeons and I do the internal medicine. So anything that's going to be in depth and I have to work really hard and think about. And it's really rewarding when we have these really difficult cases that we can see their improvement while they're here. And so anything that's difficult and we can really dive deep and research and make them better.
How has AAC supported your professional growth?
Really, again, everybody here is so supportive of everything. I feel as though when I started, I was very anxious. Becoming a new grad is very, very scary. And I feel as though I've learned so much from, again, not only the doctors, but also the technicians here. I will ask our wonderful technicians for their advice on things and their support on cases because they are so, so knowledgeable. And so having not only doctors, but also other workers here to help me with things has been so supportive and has grown my confidence by tenfold. I feel like I'm a completely different person than when I started.
That's right. What learning or mentorship opportunities do you use here?
Again, using all of my coworkers, kind of like I just said, the technicians and doctors are all wonderful. So it's not like I only have one mentor to lean on. I have multiple different people who are at the clinic with me. If I have a really difficult case, I will call even our doctors who are not working and bother them for help. And so I feel like I have so many people to lean on and I never feel left in the dust or anything like that. I always have somebody who's there to support me and help me, especially with things like exotic cases that some of the other doctors are much more versed in than I am.
Mm-hmm. So what services or equipment like the CT, exotics, 24/7 ER make your job easier or more rewarding?
Really all of that you just mentioned. So having the CT is so helpful for those advanced cases. Otherwise, I would be having to refer these patients out to other places, and so having this kind of conducive care all in one place is so great to have. We see a lot of exotics patients here as well, and while I'm not the main person who's seeing them, I do contribute to their care, especially in our hospitalized patients, and it's so nice to have that option because I can't even count the calls I've gotten saying, we have no other place to go, can we come here? And we are always obviously willing to help, and so it's really nice to have that opportunity to be here 24/7 for these pets and have the option to see these pets. And even if I'm the only one here, again, I can collaborate with those doctors who are more versed in those exotics, and I, at that point, will know what to do instead of having to just figure it out. So really all those things you mentioned, and then again, just having the support staff that is so knowledgeable and again, just makes my job so much easier.
So how involved are vets in treatment decisions here?
We do all of the treatment decisions, and again, with support from the treatment technicians and things like that, but I will see my patients, I will do their physical exam, we'll talk about diagnostics, and then fully come up with a treatment plan there. And now that could be alone or it could be a collaboration with other veterinarians that are here, but we have great electronics here that we can, for our treatment sheets, things like that, that makes it a conducive thing while they're hospitalized. And so we fully come up with our treatment sheets and then reevaluate every few hours with new doctors here to get fresh eyes on the cases, which is really nice.
So how would you describe the relationship between vets and technicians?
Like I said, it's wonderful, and ever since I've been here, again, during my externship, I was here for 2 weeks, and that was one of the things that just drew me here. I became friends with the technicians the 7 to 14 days I was here, and so we are all so close, and it's such a respectful friendship that we know when we need to be working and be professional, but we can also still have fun and be friends, but still do our job in the way that we need to. And so I think all of the vets, all of the technicians, everybody who works up front and in the back, we're all really close and really supportive of each other, which is really nice to have, especially again in a profession that's really difficult.
So what advice would you give a new grad applying to AAC?
I would say that it's going to be scary no matter where you are. Becoming a new grad feels like you're kind of thrown into the middle of the ocean with no life raft, but when you have as many people who are supportive here as you do, your hand will be held if you want it to, or it won't be held if you don't want it to. And that's the best part, is you get to decide how much you're comfortable with. You get to decide how much you want to do on your own or how much you need help with. And so just having all the support here is super helpful, because I liked my hand held for the first 6 months, and now I feel like I can kind of branch off. And so it's something that any doctor is willing to help you with however much or however little you need.
So how do you manage work-life balance while you're working here? Like, how do you recharge after tough shifts?
Yeah, I am very much a TV girl and a restaurant girl. So I like to go have a nice meal and then sit and watch my favorite show. Obviously, I have animals at home. My dog Basil, I love to walk her and take her out. So it's really nice to come home and be able to decompress after what's a long day or a hard day, but still have my pets at home who I can hang out with. And then obviously it's nice to come back and see how my patients were doing the day before. And so it is a very nice break to have, especially the 24/7 care. I don't have to go to sleep worrying about the patients as much, because I know there's other doctors and staff here who are taking wonderful care of them. And so it's really easy to kind of disconnect and go home and do my own thing, and then come back and know my patients have been really well taken care of.
Tell us about a time a colleague helped you through a difficult case.
I have had many times, I can think of that. I have had cases where my patients we have no idea what's going on with them, no matter how many tests we do, how many diagnostics we run. And there was a specific case that actually happened last week, and I had a lot of collaboration from the other doctors on it. And we actually figured out what was going on and was able to treat the animal after not knowing what was going on for multiple days. So that's the best part about having all these fresh eyes on the cases, especially on an exhausting day, is you have someone who's coming in, looking at your case for you, and it helps to say, okay, now we can perform this diagnostic and potentially figure out what's going on.
What do you think the biggest misconception candidates might have about working here?
That's a good question. I would say probably as a new grad, I just felt in general that as a vet, I was going to be kind of left to my own demise in times. And so, not necessarily here, but just in general, when you come out, you've been babied basically all of vet school, and so you come out and you're a little scared. And so I was always worried, am I going to be stuck doing things I don't feel comfortable doing? Am I going to be trapped in these cases where I don't know what I'm supposed to be doing as my next step? And I've never felt like that, which is nice because, again, like I've mentioned, I definitely wanted my hand held for the first few months, and that's what I've definitely had. And so I'd say, again, just being a new grad and coming out feeling like you might get trapped in positions where you're not comfortable is definitely not the case here.
So how would you describe the leadership here at Advanced Animal Care?
Yeah, the leadership is wonderful because of how many different kind of positions there are. So there's basically a position for each kind of, I guess, position that works here. So there are the triage people, there are the treatment technicians, and then the doctors. And so it's really nice to have all these different eyes and viewpoints so that we're not all relying on one person who, one, that would be a lot for them, and two, to have to make all these decisions. So when we have these different viewpoints, it's really collaborative. So it really makes a well-rounded leadership team to have all these different viewpoints and positions that take care of each spot here.
How does AAC handle continuing education and conferences?
So we actually not only get a continuing education stipend, but my time here is very flexible as well. If I need to take some time off to do continuing education, it has been no issue. I'm actually doing the KVMA conference at the end of this month with a couple of the other doctors. So even though all of us had to take off at the same time, we were allowed to, and we figured out time because the hospital's 24/7. So we figured out people who can work, and so it's really helpful to be able to continue to learn as I need to, as well as having different. I have a VIN membership, which is super helpful, and I use every single day. So getting those things is definitely takes stress off my plate because I have these opportunities to be able to research these things without having to spend my own money, which can be stressful.
Night shift or day shift? Which do you prefer and why?
Definitely day shift. I am a 9:30 going to bed type of girl, so I am always a morning bird, day shift. Now some of my doctors here, they love night shift and they are night people, but not me. So I'll always be that day shift person.
So if you could change one thing about veterinary medicine, what would it be?
That's a hard question. I think it's so hard to not worry about our patients when we leave. And like I said, I have the support of so many other doctors and our technicians here that I know they're being well taken care of. But just kind of having the lives of animals on our hand it's not something I think I could ever change or would change, but it is a stressful profession that even having the support, it's hard sometimes when you're in these positions, but again, having that support just really helps make it easier.
That's good. Why do you stay at AAC?
Again, I just love it here. I love all the staff, all the collaboration. I love that I have the ability to work both general practice and do ER. I have ADD, so it makes it really exciting to have different opportunities. I can experience so many different cases, so many different clients. And it's really nice to have these clients at the GP where I can follow up with long-term and see their pets. And then at the ER where I have these new clients that now we can see them at the general practice and follow up. So it's having these relationships too it's really different at the ER and the general practice, and it's nice to kind of have both of those sides.
What's one sentence or one something that you would say to convince someone to apply today?
I would probably say if you want a close-knit and collaborative place, then this is definitely the place for you. Again, I've never felt left to my own demise, and that was something I was always worried about when coming out of school. So definitely collaboration is top tier here, which is a big thing for me. So that would definitely be something I would tell somebody.
Thank you.